I'm Dr. Matthew Pieters. I am a general ophthalmologist specializing in comprehensive ophthalmology at Fraser Eye. Surgically, my specialty is cataracts. I trained at Emory University for medical school in Atlanta. My dad's actually a radiologist, and so when I went to medical school, I thought that might be something that I would be interested in, but it was way too depressing for me. So sitting in a dark room, not talking to patients, it just wasn't the vibe that I was looking for. When I had my first rotation in ophthalmology, we were lucky enough to get a week at Emory, which not a lot of medical schools do. I just fell in love with it. And also everybody cares about their eyes. So it's very rare that I feel like I'm on an opposing team to my patients. Really, everybody's coming in because they want the same thing, and it makes it just a great place to work. I did my ophthalmology training at Wills Eye Hospital in Philadelphia, which is America's oldest eye hospital. A lot of the times when we're dealing with eye care patients, usually the problems are pretty localized. The eye's a pretty unique organ, but I do have one patient that comes to mind. Sometimes small changes in the peripheral vision can actually signify something much larger. So we had a patient who came in almost reluctantly because she was just noticing that something was slightly off with her vision. We checked her peripheral vision on one of our machines, and it was slightly off, but the pattern that it was off suggested that there might be something not wrong with the eyes, but with the pathway of the vision connecting the eyes to the brain. So we sent her in to get an MRI, and she had a large pituitary tumor. And thankfully they were able to resect it, and it was able to be done without too much compromise to any of the other parts of the brain, and she's doing very, very well. My favorite hobby is slightly embarrassing. I like to birdwatch in my spare time. It's something that I very much enjoy doing from a relaxation standpoint. You can just go outside and watch birds, or you can get a little crazy with it and like hop in the car and drive across the state. Salty. I do a lot of driving, and so I'm going to lean podcast. When I do music, I get bored too quickly. I'm Apple, but for no real reason, more of the social pressure of having the blue texts, but I understand that's a very juvenile reason to have a phone and to pay more money for it. So we'll see if I stick Apple whenever I get a new phone. I would love to do a week in Colombia or Panama or one of the tropical countries and go birdwatching. That's my dream, but I need to save a little bit of money before I can do that.